Good afternoon, guys. And nandito tayo ngayon sa last topic or sa last topics ng ating Module 4, which is the perioperative care, the pediatric, maternity, geriatric care, and the death and the post-op, what's this? Postpartum care, the diseases that you are going to discuss, and emergency care. So all of this topic will be discussed on module 4. So hopefully you'll enjoy this uh, module. And this is the last module. By the way, as per our management, that the resumption of the class will still be delayed because of this current situation. So please bear with us and let's start. So let's start with perioperative care or care of patients with surgical problems. Okay, so first let us discuss what is perioperative period. So perioperative care is the care given before surgery, when physical and psychological preparations are made for the operations. So pre means before, okay, and operative is operation. So it is a care given to patients who are before operations. So that's very easy. So during preoperative care, as nursing assistant, we are bound or we are responsible in preparing our patients emotionally and physically. So first, emotionally. So how you are preparing the patient emotionally? First of all is they need to be informed about the procedure. Okay, you're not the one to inform them about the operations that they are going to have. Also, nurses, they are not also uh, responsible to inform what is the name of the operation, who will be the one uh, who will be the surgeon of the patient. So it's the doctor that needs to explain all of this stuff. So as nursing assistant, if you found patient that is anxious, okay, depressed because is so afraid of having this operation, it means that he has less information or or is not informed at all. So as nursing assistant, you inform your nurse or the nurse in charge to inform the doctor that the patient have the deficit or knowledge deficit about the procedure. So if the patient have problem, if the patient have emotional problem, instabilities because of this, so we need to report to the nurse in charge. Okay, we can help them. Okay, one way also that we can help them is we can provide or we can instruct them deep breathing exercises. So deep breathing exercises is like you instruct them to inhale sa nose and then exhale sa mouth. Okay, in that way we can help them to release their anxiety. Then next one, as nursing assistant, we are also responsible in preparing also the patient physically. So what are those things that we need to prepare? First is NPO. NPO means nothing per orem. So nothing per orem is or nothing by mouth. Ibig sabihin, instructan nyo si patient, kadalasan 12 midnight, post 12 midnight, sasabihan nyo siya at 12 midnight ma'am, dahil may operation ka bukas, wala ka nang kakainin after 12 midnight. Okay? Pagkain, lahat ng oral intake, bawal. Unless your patient is having diabetes or hypertension, okay, sometimes the doctor will order for uh, to take the medication, okay, but with sips of water only, because the problem is if they have operation, the BP will increase or the sugar will increase also. So to prevent this to happen, the doctor will order medications or antihypertensive medications with sips of water. But you're not the one who will give it if you're in the hospital, but the nurse. So expect that situation. Then test and blood works. Okay, expect that your patient who will be having operation, they will have blood tests and blood works to check if they are fit for operation. Then surgical consent. Surgical consent, okay, lagi nyo makikita to sa mga doktor. They are getting surgical consent. If one doctor told you that, can you get signature for the surgical consent? For example, sabihin ng doktor sa inyo, for example, nursing assistant, can you get a signature for this surgical consent? I already explained the consent to the patient. Okay, what you will do? Do not listen to the doctor. Do not follow the doctor. Okay, with all due respect, doctor, I cannot get signature of the patient. Uh, I am not bound to get the consent or signature of the patient, because only doctor is allowed to get the surgical consent. So that's your answer. So you're not allowed. Next. During morning, for example, the surgery will be today morning. Okay, so what you will do as nursing assistant in the day or morning of the surgery. So first is administering an enema or vaginal dose. So administering an enema, it means labatiba. So you're putting a fluid in the rectum of the patient. So you will cleanse the bowel of the patient. So what is the reason of enema? We discussed it before in elimination. Enema will cleanse the bowel of the patient. So if there's any abdominal surgery, okay, it will be clean. Okay, it will not be contaminated with feces. And vaginal, you need to clean the vagina of the patient. Why? So it will be clean during the operation. Then you need to instruct also the patient to take bath. Usually, if you're night shift, you will be the one responsible to, for example, your night shift yesterday, and then today is the operation morning. The night shift yesterday will be the one to instruct the patient or will give or assist the patient to have bathing. Okay, so ma'am, sir, it's required that you need to take your bath before operation to prevent infection. Okay, so that's your instruction. And also grooming and dressing. Okay, all operation requires only a gown. Okay, if your patient wanted to wear pajama, okay, after bathing, it's not allowed. Just explain them it's not allowed to wear pajama. Okay, you need to wear the gown because they cannot accept you. Only the gown. Okay, you instruct them also preoperative teachings. So what are those preoperative teachings? So, ma'am, sir, you're not allowed to wear jewelries. Okay, if your patient is having nail polish, remove it. Okay, and sometimes in the policy of the hospital, they are telling you that to shave the part that will be operated. Okay, you shave it. Why? Because hair will contaminate the surgery. So the doctor will tell you to shave it. So what else? Preoperative teaching. So if your patient is having anxiety, you cannot prevent that because operation it's a matter of life and death. The patient might die if they will be operated. So you instruct them. You instruct them to take to do deep breathing exercise. So you inhale with to your nose, and then you exhale with your mouth. So that's are the teachings that you can give to your patient pre-operatively. And what else? You need also to give your you to tell your patient that if you have valuables, give it to your relative, or we will get it, and we will put it into the security, because especially mobile phone is not allowed in the operating theater. So what we are doing, we are getting it and we're giving to the security. Then preoperative checklist. Preoperative checklist is the list of the things that you need to do before operation. Okay. Usually this one, it's filled up by the nurse. And don't forget anything like uh what's that? Artificial teeth, dentures, it's not allowed during operation. It needs to be removed before operation, because if your patient is taking is will have general anesthesia, they will put a endotracheal tube, okay, to give you oxygen while you're on general anesthesia. So they need to remove it because the patient might aspirate the dentures. Okay, so that are the things that you need to do during preoperatively. Next is intraoperative care. Intraoperative care are care during an operation and ancillary to that operation. Intra means during, okay? It means that is current operation, ongoing operation. What are the things you need to do during ongoing operation? So preoperative is before, intra is ongoing operation or during the operation. So this one, usually only responsible healthcare professionals there is the nurse and the doctors, the assisting nurse and the doctors itself. So that's intraoperative, and the anesthetist. Lastly, we have the post-operative care. Post-operative care are care received after operation. Post means after, operative means operation, and care. So it will be care after operation. So what are the things that you are going to discuss to your patient post-operatively? So first, we need to prevent complications. Okay. We, as nursing assistant, are very helpful to our patient to prevent complications that might happen after operation. One of those are respiratory problems, which is atelectasis. So again, atelectasis is lung collapse. Okay, when you have given an anesthesia, okay, your lungs will sleep. Why? Because anesthesia will relax your body. So all of the systems of your body will be relaxed. That's why they are putting you an endotracheal tube, so to give you an artificial oxygen. So to prevent this atelectasis, okay, as nursing assistant, we need to instruct them to do deep breathing exercises and coughing exercises, okay, to re-expand the lungs. And to prevent atelectasis, we need to instruct them, brother, sister, you can put a pillow, okay, in front of your stomach, put a certain pressure, and then you cough. And then you do deep breathing exercises. You can do it, okay, when you're awake, as many as you can. So this will prevent atelectasis or lung collapse. So this will be one complications that you're preventing while you're instructing the patient. Then you can give the patient incentive spirometry. Okay, incentive spirometry is a device that I showed you before that will prevent atelectasis. You're inhaling and making and you're inhaling and you're making the ball, okay, to move it up, okay. While the ball is moving up, okay, it means that you're expanding your lungs. So you need to do it also while you're awake, as many as you can. Next is sequential compression device. Sequential compression device. So these are the devices that are being put or being applied to the legs of the patient to prevent DVT or deep vein thrombosis. Okay, if your patient is bed rest, lying on bed, and because she or received a general anesthesia, of course, the body is relaxed. So the risk is the patient can have DVT or deep vein thrombosis or clots in the major arteries of the legs or the limbs. So you can prevent that by putting a sequential compression device. It's a device that it's a foam that compresses your legs. Compress and then it will open, compress, then it will open. Okay, so to make your leg circulation, to promote leg circulation or blood circulation in your legs. Then anti-embolism stockings. Okay, when you're going out for a long trip, okay, you can put anti-embolism stockings. It's like a stocking which is uh, that you can buy. It's costly, but it's very effective to prevent embolism. Then we can put it also with our patient. Then we can do leg exercises. Okay, I told you in the activity discussion, you can do dorsiflexion and then plantar flexion, then internal rotation and external rotation, and then inversion and then eversion. So you can do this to prevent this uh, deep vein thrombosis. Then we can assist with positioning, okay, for those patients who receive spinal anesthesia. Spinal anesthesia, at least 24 hours, the patient needs to be flat on bed, no pillow. Why? Because if you allow your patient to be foulers or to sit on bed for a long time, the patient will have spinal headache and it's too painful. Okay, it's the side effect of the spinal anesthesia. Also, if the patient receive general anesthesia, the patient after operation then is telling, I want to go to washroom because I want to pass urine or I want to pass stool. So if this happens, you tell your patient you need to wait 4 to 6 hours, okay, to up go up of bed. Why? Because the patient might collapse. This is the effect of general anesthesia. So the first time that your patient will stand or will sit, you need to assist them because the possibility is the patient might have dizziness and the patient might collapse and then fall and then you will have a lot of problem. So you need to instruct the patient to take care and to follow you because it will be for him or her. So you need to assist at first if the patient received general anesthesia. Next, you assist the patient with nutrition. Of course, 8 hours NPO or 12 hours NPO, the patient is very hungry. So first, assist him or her with the nutritional requirement that is being ordered by the doctor according to the condition. If the patient is diabetic, if the patient diabetic. Usually, the patient who receive general anesthesia will have food or oral intake after 4 to 6 hours. Why? Because the patient will vomit if you give oral intake. Okay, so always remember that. You need to wait for 4 to 6 hours after operation to take oral intake. Then, assisting with the elimination. Assisting with elimination, okay, you instruct your patient, if your patient is having spinal anesthesia and then he's insisting to go out of bed, you explain to him that you cannot go out of bed because you need to stay at the bed 24 hours because you can have spinal headache. So you give him anything for elimination like or diaper, so he can eliminate. Then assisting with hygiene. Of course, if your patient long time he did not eat, long time he have no oral intake. So the problem is he have problem with oral. He have bad breath. So what you will do is to give oral care to your patient. Then assisting with walking. So especially for those patient who receive general anesthesia, you assist the patient while he is walking because he can fall because he might uh, become dizzy. So these are the things that we are nursing assistant, we can assist and we can help the patient. So thank you very much. Bye.